In this video, let's have a look at the surface anatomy of some of the upper face muscles that we target with botulinum toxin during our treatments. If we look at Hannah now, you will notice the two white lines at the sides of her face which denote the temporal crests, and in the vast majority of people, the frontalis lies between these crests. The frontalis originates from the galea aponeurotica and then will insert into fibers of the procerus, corrugator and orbicularis oculi. In the midline, the fibers of the frontalis may be absent and replaced by the galea. The frontalis is the only elevator of the brow, and we can see Hannah here as she raises her brow, she forms horizontal creases. On the right, I have denoted the corrugator muscle in purple, and on the left I've denoted the orbicularis oculi. Remember, the lower fibers of the frontalis will interdigitate with the corrugator, procerus and orbicularis, and therefore we have to be very careful with toxin placement and depth in this region. Now let's have a look at the brow depressor complex. The first muscle to look at here is the procerus. The procerus originates from the fascia overlying the lower nasal bones and cartilage and inserts into the skin between the eyebrows and also the lower fibers of the frontalis. Its action is to bring the heads of the brow inferiorly down, and in doing so, it creates transverse lines on the bridge of the nose. The next muscle to look at is the corrugator supercilii. This has an origin on the superciliary arch of the orbital rim, and the fibers then ascend vertically, laterally and anteriorly to insert into the dermis of the skin. The insertion will have a variable place and may be medial to the midpupillary line or lateral. If I get Hannah to frown, we notice there's a little dimple at the insertion of the corrugator. So the important message here is that when we inject the head of the corrugator, we must be deep onto bone where the origin is. However, when we inject the tail, it's important to be superficial as the insertion is in the skin. If we're deep, we can actually cause lidosis due to the toxin affecting the levator palpebri muscle. Finally, we have the orbicularis oculi. This has a orbital portion, a pretarsal and a preseptal portion. The pretarsal and preseptal portion are involved in an involuntary blink reflex, and the orbital portion is involved in voluntary eye closure. If I get Hannah to scrunch her eyes shut tightly, we will notice a couple of things. We can see that from the side view, the first thing is she may form some lateral canthal lines or crow's feet. The second thing is the vertical portion of the orbicularis oculi causes the tail of the brow to descend. Accordingly, we can take advantage of this and inject toxin into the tail of the brow, which can give us a lateral brow elevation due to action of some fibers of the frontalis.